Let's check in with Eden.
We're here paying a visit to Heekin Clinic and meeting Dr. Ralph Rizk, an orthopedic surgeon who, you're from Jacksonville and you're back home again. Welcome back.
Thank you. It's exciting to be here. I was actually raised in Jacksonville. I went to Bowles High School and grade school and did my training in Tampa and ultimately went to Pittsburgh for my fellowship, and now I'm back. So I'm excited to be next to my best friends and my family, and I'm excited to treat the people of Jacksonville.
And I know that that's a comforting feeling when you come to a place like Heekin Clinic. You know, maybe you have an injury or pain and you want to have that comfortable feeling. What is the first course of action if someone comes to you, Dr. Rizk, and they're experiencing pain?
Well, we try and diagnose their hip or knee pain initially if they are coming for that. We do a physical examination, get our proper imaging, and we always try to go conservative first. If that means physical therapy, if it means anti-inflammatory, some type of medication. If that doesn't work, then we have options such as injections. And if that doesn't work, there's always surgical options for their hip or knee pain, and that could, span anywhere from partial knee replacement to an arthroscopy, which is a cleanup scope, or a full knee or hip replacement.
So making an appointment with you and coming to see you doesn't necessarily mean surgery. It could be that you take a much more conservative approach, as you just said. But let's say, as you mentioned, things do progress to a point where you do require surgery. You have all kinds of options there as well. It's not like a one-size-fits-all situation.
Certainly, and it all depends on what their pathology is. It depends, hip or knee pain. We have arthroscopic procedures that are options. We have partial knee replacement, full knee replacement. It all depends on what the patient needs. And again, we always emphasize conservative care. I had a patient that came in with just a small knee sprain that we treated with some physical therapy and bracing, and they did fine and they didn't need surgery. Just because you see orthopedic surgeons certainly doesn't mean you need surgery.
Now, what if in the case of surgery, would a recovery look like? What are the expectations for somebody's recovery? Length, timing, process, more physical therapy? How does that work?
Sure. So we'll start with hip and knee replacement. Typically with those is you have your surgery, you get up the same day and you walk the same day. You're working with therapy that same day and the following weeks and ultimately months. There's obviously driving restrictions that we have in the beginning, and I'm always in touch with my therapist to make sure that I am continuing to talk to them about my specific patients, and I give my patients my cell phone number to keep the communication going with me and just allow them to get educated to really optimize their outcome.
So there really is so much follow through. That's surprising. Up and walking that same day.
Yeah.
That's surprising. That might even inspire some people who have been experiencing pain to actually make that call towards having a more comfortable life. So if you are interested in more information, heekinclinic.com. And Dr. Rizk, welcome to Jacksonville.
Thank you. It's
your
great
hometown.
to be back. Yeah, good to be back. Thank you.